Hey there, I'm Dr. Sean Odell from Smiley Orthodontics, and today I'll be answering some questions y'all may have about orthodontics. Alright, we'll get started with the first question. What is orthodontic treatment? So, what orthodontic treatment is just using braces or aligners to move teeth so that they are in a better functional position and that they're more aesthetically pleasing. Who can get orthodontic treatment? Orthodontic treatment is really for anyone that has healthy teeth who'd like to improve their smile and have a better bite. When is the soonest someone can start orthodontic treatment? The American Association of Orthodontics recommends having an evaluation at age 7. That doesn't really mean that we're going to start braces on a 7-year-old necessarily, but sometimes it's a good idea to catch a problem early. And so having things checked out at age 7 or 8 thereabouts is, generally a good idea. Can someone be too young or old for orthodontic treatment? Well, like I said earlier, generally the AAO recommends having things evaluated at age 7. So if people come in younger than that, let's say a 5-year-old, odds are we won't really be doing any braces or orthodontics, just because there'll be a bunch of baby teeth and no adult teeth yet. As far as being too old for orthodontics, that's kind of a judgment call. There will be some people that, want to do some orthodontics at an older age, and as long as their teeth are healthy and they want to go through with that, then I say more power to them. They sure can. So, are people of varying age groups treated differently? If so, why? So yeah, so children are generally treated a little differently than adults in some cases. Part of that is because children may be growing still, so their jaws may not be fully developed, and you may be able to alter that to a limited degree. Um, Whereas with adults, they'll be done growing at that point, so you don't really have much growth to really alter or work with. Another difference with adults is that generally their teeth will have a little more work done. So they'll might have some crowns or bridges or implants or other things like that that may need to be taken into consideration as far as their orthodontic plans. So that's a good question, yeah. Are there any other treatments that I may need alongside my orthodontic treatment? So sometimes there can be the need for additional specialists to be involved in your orthodontic care. That may involve a oral surgeon if we're planning on, potentially corrective jaw surgery or bringing in impacted teeth. Perhaps a periodontist, which is a gum specialist, if there's some gum concerns or other things like that. And of course, the general dentist too, making sure that your teeth are healthy enough to really get started with orthodontics and continue with that. So those are probably the groups of other dentists that we really work with the most. Braces or Invisalign? Seems like lots of people really want Invisalign. There are some downsides to Invisalign, though, in comparison to braces. Probably the biggest being compliance. So, with Invisalign, patients really, really need to wear their aligners. We recommend 20 to 22 hours a day. And some patients are able to do that, and some aren't. So, really all that responsibility kind of ends up falling onto the patient's shoulders, which can be a big ask. The other thing to know about Invisalign or clear aligners is that, you know, they're not quite as efficient as moving teeth. So if you have big complex movements or a lot of crowding or, some bigger things going on, well, braces offer more control. So if that's the case where, you think, oh, I might struggle to wear these or, oh, we're doing some big things, probably braces are a better option. If you have some relatively mild crowding or some smaller things going on and your movements aren't going to be as dramatic, then yeah, sure, then, aligners might be a good option for you. How long can I expect to be in orthodontic treatment? Most patients will be in orthodontics for a year and a half to 2 years. There may be some situations where it's a little shorter or longer. If you've maybe already had orthodontics before and your teeth are pretty straight, it might be a little bit shorter term that you're in them. If you have some bigger, more complex things like bringing in an impacted canine, for instance, that may take longer. I always kind of talk about impacted canines as kind of being like a wild card. You never quite know how quickly they're going to move or how well they're going to come in. So there's a kind of an unknown there. So I kind of usually prep patients to say, well, this might end up taking a little bit longer. Hopefully not, but there can be variation. So, last question here. What happens after I finished orthodontic treatment? So, that's a great question. So, after we've got things straight, everyone's happy, things look good, they feel good, well, we need to keep them that way. The best way to do that is with orthodontic retainers. Most commonly, those will be clear, like plastic shells that kind of go on and off your teeth. And those will just help keep things where they are after all that hard work. Another type of retainer are bonded retainers, which are more or less, wires that are glued on the backside of your teeth. They have a couple of issues or potential issues. One is they're difficult to clean around. Number two is that they can break or come loose. So I don't see bonded retainers as an alternative to the removable retainers. I will usually do both if we're going to do bonded retainers, because the other things to know about the glued in or bonded retainers is that they can break. And so if they do break, you're going to want to have something to still hold everything together um, where they should be. And the other thing is that the bonded retainers don't do anything for the back teeth, right? They just are glued onto the front teeth. So those back teeth can kind of shift or move. I just recommend to keep your bases covered. Stick with removable retainers. If you want bonded retainers, we can maybe discuss that and what that looks like for you. But I don't see them as an alternative to the removable retainers. I just see them as in addition to. So, all right. Well, hey, thanks for tuning in. Again, this is Dr. Sean Odell from Smile Orthodontics. If you guys have any more questions, feel free to just connect with us on social media. I'd be happy to answer some more. Thanks.